In this video, we'll be talking about the radial nerve, its course, and what are the possible symptoms if there is any damage to the radial nerve. So, the radial nerve, first of all, arises from the posterior cord. So, as we know that the cords of the brachial plexus are named as the medial cord, the lateral cord, or the posterior cord based on the relation to axillary artery. So this over here is the axillary artery, the cord which lies medial to it, like this cord. So this is the medial cord. The cord which lies lateral to it is the lateral cord. So this here is the lateral cord, and the cord which lies posterior to it and is almost hidden by the axillary artery is the posterior cord. So if I zoom in, you can see that this cord is lying posteriorly to the axillary artery. So this here is the posterior cord of the brachial plexus. So this here is the posterior cord of the brachial plexus, and we know that the radial nerve is a branch of the posterior cord of brachial plexus. So this is the posterior cord of the brachial plexus, and we can see one nerve coming out of the posterior cord. So this nerve over here is the radial nerve. So this nerve over here is the radial nerve. So we can see that the radial nerve is lying over the back muscles. So if I rotate the model posteriorly, we can see the back muscles. So this is the this is the supraspinatus muscle, and these muscles are the teres major muscle and the teres minor muscle, and on the ventral side will be the subscapularis muscle, and we can see this is the radial nerve. The radial nerve is lying over the surface of these back muscles, the teres major, the teres minor, and the subscapularis muscle. Now, after arising from the posterior cord and lying on the ventral surface of these muscles, the radial nerve can be seen coming out through this intermuscular space. So, this intermuscular space is lying in between the teres major, the long head of the triceps muscle, and the humerus. So this triangular space is known as the lower triangular space, and as we had discussed in our video on intermuscular spaces of scapula, uh, the radial nerve along with the profunda brachial artery exits out through this intermuscular space. So we can see that the radial nerve is exiting out through this space, and then it is supplying the long head of the triceps, and also the lateral head of the biceps, of the long head and lateral head of the triceps, not biceps. Now after supplying these muscles, uh, it travels over the spiral groove. So a radial a groove is present on the posterior aspect of the humerus. So there's a groove present on the posterior aspect of the humerus, which is hidden by the long head and the lateral head. So the roof of this radial or spiral groove is formed by the long head and lateral head, and it is a spiral groove like this. And what radial nerve does is, after exiting out through this intermuscular space, it winds around the humerus in this spiral groove and then comes to lie anteriorly. So it is coming to lie anteriorly, and then it descends downward, and comes to lie uh, and then it comes to lie on in front of the lateral epicondyle of the humerus. So this here is the humerus, and this is the lateral epicondyle of the humerus. So after coming to lie around the lateral epicondyle of the humerus, it gives branches to external extensor carpi radialis longus muscles and extensor carpi radialis brevis muscles. So this over here is the extensor carpi radialis longus muscle, and we can see it is traveling at the back of the forearm and attaching to the posterior aspect, and is responsible for the extension of the digits. So around the lateral epicondyle. It gives supply to the extensor carpi radialis longus and the extensor carpi radialis brevis. Then this radial nerve comes to lie in the cubital fossa. So this over here is the cubital fossa, and we know the boundaries of the cubital fossa is being formed by the pronator teres muscle. So this over here is the pronator teres muscle. The lateral boundary is formed by the brachioradialis, which has been removed, and the roof is formed by an imaginary line joining the medial and lateral epicondyle. And we can see that the radial nerve is coming and it is dividing into one superficial branch. So this is the superficial branch, and if we rotate the model, we can see that this is the radial nerve, this is the superficial branch, and this here is the deep branch. So the superficial branch of the radial nerve, as we had studied in cubital fossa, is the content of the cubital fossa, and then there is this deep radial nerve, also known as the posterior interosseous nerve. Now this posterior interosseous nerve supplies the muscles on the extensor aspect of the forearm. So we can see that this muscle is going dorsally and will be supplying the extensor aspect of the forearm muscles. And now this superficial branch of radial nerve, it descends and then it travels to the lateral aspect of the forearm. So we can see this nerve descending and then traveling to the lateral aspect of the forearm. And if I rotate the model, you can see that the superficial branch of radial nerve is lying between these four tendons. So these are the extensor carpi radialis longus and the extensor abductor pollicis longus and extensor pollicis brevis tendon, and this here is the and this tendon over here is the extensor carpi radialis brevis, and this tendon over here is the extensor pollicis longus. So it comes to lie between these tendons, abductor pollicis longus, extensor pollicis brevis, and extensor pollicis longus, and the space over here we know is the anatomical snuff box. So it has descended all the way down, traveled on the lateral aspect of the forearm, and now it is coming to lie in the anatomical snuff box, and now it gives superficial branches to the dorsum of the hand. So this over here is the dorsum of the hand, and it gives sensory branch to the lateral aspect of the dorsum of the hand and lateral 2.5 digits except the distal part of the digits.